Brilliant. Thank you, Alex. Welcome everyone to this week's webinar on supporting mental health in the construction sector. My name's Vicky Cotman and I am the workplace lead at MHFA England. I'm delighted to be joined by Sarah Bolton, Paul Hay and Elvin Box, who will be introducing themselves shortly. But today they will be sharing their expert insights on the impact of the pandemic on the construction industry, best practice for workplaces, and sharing some helpful resources for you to take away today. So we're going to be covering and looking at how kind of pressured deadlines, high workloads and other factors might be having an impact on mental health in the sector, exploring how new working environments and changes to physical workspaces have affected wellbeing, and sharing some advice and resources for managers to help build their confidence to support their teams and have confident conversations about mental health moving forward. So I'm going to go over to the panel and give them an opportunity to introduce themselves. So Sarah, if I can start with you.
Hello, my name is Sarah Bolton. I'm the head of the charitable services for the Lighthouse Construction Industry Charity. I've worked in support for over 10 years. I'm also an MHFA instructor. At the Lighthouse Club, we support people with training, helpline and lots of other things towards mental health.
Brilliant, thanks Sarah. And Elvin, if I can come to you next. Elvin, I think you're on mute.
Good. Can you hear me now?
Yes, we can.
That's better. Yeah, I do apologise. Yeah, so my name's Elvin Box. I am chair of London Constructing Excellence Club. By day, I'm an organisation development consultant. Background is I'm a time-served apprentice carpenter and joiner. Into I think it's the 4th decade in the construction industry. My background with mental health and how I've got involved with it is that I have suffered with mental health challenges. First time in my early 20s when I was an assistant project manager and a guy fell 6 floors to his death and I went to his aid. And more recently, the agonies and the anguish of being diagnosed and treated for prostate cancer led me to have some challenges with my mental health. Hence, I am a Movember ambassador, so I'm very busy this month with mental health talks and prostate cancer talks and men's health in general. I am a mental health first aider and more than delighted to be here today and will take any questions whatsoever and will be as much help as possible. Thank you, Vicky.
Brilliant. Thanks, Elvin. And Paul, if I can come to you as well to introduce yourself.
Yeah, thanks, Vicky. Hi, everybody. So my name is Paul Hay. My day job is I'm the health and safety training manager for Lendlease. I've been a health and safety manager for the best part of nearly 30 years now, which makes me feel very, very old. And over those years, I spent the bulk of my time working in construction, facilities management, those kind of industries. My involvement in terms of our mental health program, so Lendlease, we started our program back in kind of 2013-ish, and I've been involved with it since then. I, along with a couple of other guys in our business, are the operational leads for our mental health program, and I'm also, like Sarah, Mental Health First Aid England instructor as well.
Brilliant, thanks Paul. So as you can see, we've got a fantastic panel joining us today, and I'm really excited to dive into some of the conversation around the topics highlighted. So the CITB reports that there are 330,000 construction businesses employing 2.1 million people in the UK in this sector. And reports are showing that long hours, job uncertainty, tight deadlines are some of the top reasons that are contributing to an increase in stress within the sector, alongside over 400 construction workers completing suicide every year. And with this, it's absolutely crucial that both employers and individuals are actively working to manage and to look after their mental health for themselves, their colleagues and their staff. Before I move into the conversation with our wonderful panelists, you now have the opportunity as an audience to take part in the first exercise. This doesn't require you to do anything kind of on the tech side, but if you have a piece of paper or a really great memory and you want to write some of these down, I'm going to read some stats out to you. And this is just an opportunity for you to reflect on some of these statistics and think about whether they're true or false or not. So to start with, 70% of those in the industry experience stress. 45% of those in the industry experienced depression. 40% of those in the industry say they have had no formal training over the past 3 years for mental health. 31% of people said their employer would treat a mental health issue extremely seriously. And 26% of those in the industry had suicidal thoughts. So I'm just going to give you 20 more seconds just to reflect on those statistics, and then I'm going to take you through to the answers. Brilliant. And if we can have a look at some of the answers for that. So the first stat was 70% of those in the industry experience stress. And the answer to that is false. It's actually 97% of those in the industry have experienced stress, so significantly higher at 97%. The second was 45% of those in the industry experience depression. And the answer to that is false, also significantly higher. It's 70% of those in the industry experienced depression. The third was 40% of those in the industry say they have had no formal training over the past 3 years for mental health. And that's also false. You might be seeing a bit of a theme here in terms of the stats in this exercise, but that was 71% felt they had no formal training over the last 3 years. The next stat was 55% of people said their employer would treat a mental health issue extremely seriously. It was actually only 31% who felt that their employer would take a mental health issue extremely seriously. And the final stat, 1 in 7 of those in the industry had suicidal thoughts. Unfortunately, that's also false, and it's more than 1 in 4, so 26% of those in the industry had suicidal thoughts. And I'm sure most of you will agree that these are quite shocking statistics, high statistics with regards to mental health across the construction sector. And I'm really, really keen to hear from the panel on their thoughts and reflections on this. And before we move into that, I'd just like to open up our first poll question to the audience to kind of kickstart that conversation. But also just to say that if anybody does have any, wants to find out more information about those stats, this CIOB report that came from is a fantastic kind of read. So I really encourage you, and we'll send the link round after this to make sure that you have access to that. So to open the first poll, I'm going to give you 30 seconds just to reflect on this question. And if you could just fill out the answer when it comes up. So the first question is, how do you feel the pandemic has affected the mental health of employees working within this sector? I'm just going to give you 20 seconds to vote on that. Okay, Alex, and if we can see the results of that poll. Okay, so we've got 1% very positively, 2% somewhat positively, 2% neutral, 37% somewhat negatively, and 57% very negatively. So I think that's actually coming out when we've done this poll in other sectors before, coming out actually slightly higher on the somewhat and very negatively side of that poll. And Paul, if it's okay, I'd like to come to you first. I guess reflecting on the statistics and those poll results, are you surprised by the results at all? And what concerns have your kind of workforce had at Lendlease during this period, and how have you been supporting them?
Thanks, Vicky. So no, the simple answer to your question is I'm not surprised at all, to be quite honest. I don't think anybody would be. I think it's quite interesting, actually, if we consider that the CIOB survey was done, I believe, in sort of October, November of last year, prior to the pandemic sort of striking. I think most people would be alarmed at those statistics anyway. You know, the sort of 1 in 4 people in the industry sort of contemplating, considering, thinking about suicide is in itself a shocking statistic. But I suspect if we did the same survey again now, sort of 8-9 months on from the pandemic, I sadly think those statistics would probably be a bit higher. So I'm not surprised at all by the stats around that, and I don't think obviously it's just construction that's been adversely affected by this. I think most areas of life probably have. I guess in terms of the impact on our business, I suppose it's probably worth looking at it from 2 perspectives. Obviously from the Lend-Lease perspective, but also from our supply chains perspective. As an organisation, we don't directly employ any blue collar workers. You know, we're in essence a management organisation, a principal contractor. So most of the people that work on our projects aren't directly employed by Lend-Lease. So I think from Lend-Lease, yes, of course, you know, we've seen an upturn in things like conversations. We've seen an upturn in the number of people seeking help through professional resources we have available. So our in-house employee assistance program, we're looking to have private healthcare insurance. So we're seeing referrals going up through our Bupa membership as well. We have put things in place to try and help with that. But inevitably, you know, the sort of the impact of this whole situation has been pretty profound on our workforce. Very sadly, as well, as many other organisations have had to, we've also had to sort of do some cost savings. So there's been redundancies as well. So it's not been great. It's not been great at all. A supply chain, I suppose, is a bit different. Because it's far more difficult to gauge. Certainly from a sort of a central perspective, the impact of this on them. But anecdotally, I guess that they probably have been hit more hard than maybe we have as a business, in the sense that you know, a lot of these organisations don't have the resources that we have available in terms of things like in-house EAPs and private healthcare. They're maybe not as far along their journey in terms of the mental health support available, so they may not have things like mental health first aiders in place or other resources. But I tend to find with these kind of things, it's probably not going to be until maybe this time next year that we're ultimately going to find out what the impact was. It takes some time, I think, to properly gauge the impact. But it's just very challenging times and very difficult times for everybody, I think. And you know, no matter what industry you work in, what area of life you operate in, I think we can all see that that this is sort of having a pretty profound impact. And you know, I very interestingly, I was watching something on TV the other night. It was one of these kind of fly on the wall documentaries where they were following paramedics around, and you know, the paramedics were saying that the number of calls that they're having now to suicides, attempted suicides, is through the roof. You know, and that again for me is a very obvious indicator of the fact an awful lot of people are struggling out there at the moment.
Brilliant, thank you, Paul. Sarah, if I can come to you, I'd love to hear your kind of thoughts and reflection and share a little bit about why you think this might be.
Yes, so since obviously the beginning of the pandemic, we've seen a 56% increase in people calling our helpline. That has kind of dropped down a little bit, but now the cases that are coming through are all really serious and in depth. So we've had about a 200% increase in case calls. And they're not for the things that we used to get called for before. They're all very sort of inextricably linked, financial and mental health related, much higher regarding suicide and issues relating to suicidal thoughts. So this is clearly showing a negative effect. I think Paul touched on the fact that there's been also a lot of job redundancies, which has also caused a lot of issues. So I think this hasn't been a good time. I mean, generally coming up to this time of year, we are a little bit busier, but we've seen a massive increase. And there's lots of other things that are coming out that we wouldn't normally have heard about. So there's increase in domestic violence, increase with issues with children that are having thoughts. It does affect the work, it affects the families that support.
Brilliant, thank you, Sarah. And Elvin, if I can come to you next in terms of just your reflections, I guess, on both the statistics and the results of this poll.
Yeah, certainly. Can you hear me okay, Vicky?
Yeah, I can hear you really well.
Yeah, just read a lot, as already said by Sarah, and then initially by Paul. I think anyone would be shocked if we didn't get those sort of results. I think that's the first thing. My concerns are that there's insufficient congregation and socializing at the moment, which means that you can't do what everybody tells you to do, is to talk openly and naturally about your challenges. So that worries me a lot, because specifically in construction, because construction has been asked to keep going. And whatever happens, by the look of it, they'll want construction to keep going. Now, that must put pressure on the guys because of their concerns and their families' concerns of, sadly, high risk of actually being contracting COVID. So that must be something that plays in their mind desperately. We've already touched upon it, but we can't ignore it. And Sarah's made a point, and Paul's made a point, is redundancies and job losses. And where I'm concerned about is that young people's careers are being thwarted early on. So that is desperately worrying, because young men are more prone to mental health challenges than the older you get. That's a bit of a generalization. The other point, I think, just to round it all up, is that I will be going on, no doubt, before the end of this session, talk about how to build your resilience. And one of the things to build a resilience is to keep active and to be as fit and healthy, as strong as possible. And unfortunately, those outlets are being taken away as well, because no soon after the gyms brought back in and swimming pools been brought back, they've been taken away again. So all in all, it's very difficult, and we've got to be really creative in ways that we can find to overcome these barriers. Hopefully the vaccine will work miracles, but I think in the meantime, we've got to work together and be really creative and imaginative how we can overcome these challenges. I hope that's helped, Becky.
That's brilliant. Thanks, Elvin. And I think your point actually leads us into our next poll question really well, around making sure people feel that they can talk openly about their, I guess, how they're feeling and if they are struggling at this point. So with that, I would really like to take us to our second poll for the audience, and ask the question of how confident would you feel having a conversation with a colleague about their mental health, either online or face-to-face. So I'm just going to give you 20 seconds again, if you can, just to vote on that poll, and then we'll reflect on the results. And Alex, if we can see the results to that poll, that would be fantastic. Brilliant. So the results for that are 2% very unconfident, 8% somewhat unconfident, 8% neutral, 44% somewhat confident, and 38% very confident. So it's really great to see actually the majority sitting in somewhat confident and very confident in having a conversation with their colleague about mental health. And I guess, Elvin, what are your reflections on this, and any kind of tips or tools for those that may not be feeling, I guess, necessarily really confident in having a conversation? What would your kind of advice be in terms of how do we create that environment about making sure we can talk about our mental health?
Yes, Vicky, the results are really good. First of all, the results are really good, and I think reflect the amount of positive, if you like, positive marketing we've given to the challenge, and at last it's being looked upon as actually, we're turning it around. It's not something that you should be fearful of. It's something that you should want to embrace, which is brilliant. Talking about how can you be more confident, the things I would ask and encourage people is that it's almost the worst you can do is not talk. If someone's reached out to you at that moment, you're the most important person in their world, and you should embrace that. And it's a privileged position to be in. And all you've got to do is to remember, let them speak, you listen. It's really that simple. Everybody thinks you've got to come up with the right answer. So you've got this problem, I'll tell you what to do. So don't think that's the way. It's all about listening. More important that they know you're listening, actively listening, and actually encourage them. Go on, mate, you're doing well. And ask open questions as against closed questions. It should be, okay, so what is it that made you feel like that? How do you think you might be able to improve upon that? All the time, not trying to be, the confessor. You're helping them to bring out all that anguish. And even if after 30 minutes, you've not suggested one thing, but they've talked all about their challenge, that's been a good job done. A good job done. So of all the things I would like guys to do is when you're spoken to, your job's to listen and to encourage. Does that help, Vicky?
That's great. Thanks, Elvin. Yeah, couldn't agree more. I think listening is a really, really key part, and just allowing that space for people to talk. That's great. And Paul, if I can come to you next. Obviously, really great to see that many do feel confident about having a supportive conversation. Any further, I guess, reflections on this, or anything you feel that I guess workplaces or organisations can do to create that environment and break the stigma down around having the conversation?
Yeah, sure. I suppose again, there's the sort of two elements to this, aren't there? There's the sort of culture within your own organisation in terms of how able people feel to have those conversations, but then there's the culture within the wider industry, which impacts both on your culture, but also, of course, your ability to engage with people like we have on our projects, where we're dealing with people that don't work directly for our business. I'd like to think that as an organisation, again, we're fairly good at this now. We have a fairly open culture where people know that conversations are taking place for the right reasons. And I suppose, to put my kind of mental health first aid instructor hat on for a moment or two, one of the questions that I often get asked is, how do we have these conversations? And sort of Elvin sort of touched on it really, but how do we have these conversations, and how do we know they're effective? And to me, there's no real sort of rocket science. There's no sort of, kind of mysterious kind of talent you've got to develop to be able to do this. It's just engendering a culture whereby it's okay for us to ask how someone's feeling, and it's okay for us to open up if we're not feeling great. And, to use the physical health analogy, wouldn't it be a wonderful situation if I rocked up to work on a Monday morning and could turn around to one of my colleagues, and in the same way I might say that I put my back out, doing a bit of gardening at the weekend, or I tweak my hamstring playing football, or whatever the case may be, if I could turn around to one of my colleagues and say, do you know what, I'm not feeling great today, things don't feel good today, and we could have that sort of conversation. And I know that's probably not somewhere we are at the moment, but I think that's where we should be, striving. If I can just very quickly throw in maybe a little personal story, like many of us on this call, no doubt, I was furloughed for 2 or 3 months earlier on in the year, and I suppose there was a bit of a novelty to begin with. The sun was shining, I could keep myself busy doing all those chores that I hadn't had the time to do before. But what I noticed after about sort of 5 or 6 weeks of it, I found that my personal mental health absolutely started to dip. I've never experienced it before. I always, whenever I do my mental health training, I always describe myself as a bit of a fraud, because I don't really have that direct lived experience that many other people do, to bring to the party, so to speak, from a perspective. But for the first time in my life, as far as I can figure, I genuinely started to recognise my mental health was dipping, for all sorts of reasons. And I thought, you know what, Paul, it's time to take a bit of your own medicine here, and to sort of practice what you preach a little bit in terms of opening up. And I did just that. And I started talking to people. I started telling people how I was feeling, whether that be my my nearest and dearest, my family, my close friends, but probably more importantly, my colleagues. I started sort of opening up to my colleagues. I'm pretty lucky. I work for quite a close-knit team, and we were having kind of regular catch-ups anyway. But I started telling them that I'm not feeling great, that this is starting to impact on me. And you know what? Without wishing to be too cliched about it, it absolutely felt like the weight had been lifted. Just being able to talk to people and explain to them that I wasn't feeling great. And do you know what also happened? They started telling me the same thing as well. You know, and that again, age-old saying of a problem shared being a problem halved, absolutely 1,000,000% true. And it really, really did just sort of reinforce this thing that this thing of talking and being open and having a culture where you can do both of those things is incredibly, incredibly powerful. So yeah, you know, from a personal point of view, I took some of my own medicine and tried to do some of what I've been talking about, and it absolutely worked. And talking to other colleagues, you know, and although we're not through it yet, of course, most of us are back to a position where we're at least working full time. You know, a lot of them have also told me that the ability to talk to friends, colleagues, family, etc., about how they were feeling was a massively impactful and powerful thing to be able to do.
Brilliant. Thanks, Paul, and thank you for sharing your personal story there. I think it's fantastic to hear that. So thank you so much. Sarah, if I can come to you next and just ask any further reflections on the poll results, but also around if you've got any kind of top tips or resources in terms of how people can be confident in having the conversation and possibly spotting the signs to be able to have that conversation in the first place.
Yes, I think it's as the other chaps have pointed out, it's really important to be able to be confident in what you're saying. And I think you don't have to have all the answers. Sometimes all you have to do is listen and have the time to listen. So I think we're all really guilty of sort of running past somebody and saying, "Hi, how are you?" and not really listening to the answer. So I think if you spot somebody in your team or somebody you work with that you think is actually not their usual happy-go-lucky self, it's about making the time to really ask twice and to really listen to the response. And I think Elvin touched on it, is to listen. You don't have to answer, you don't have to have a solution, but sometimes that's all somebody needs. And as Paul was saying in his example, just by sharing with his team and his colleagues, it actually prompted the conversation that a few of them were feeling like that, and it did help, which I think when we're preaching it, we sometimes forget the practicing of it. And we're very guilty. I'm very guilty of not actually listening, to thinking I need a bit of time out now, and it's okay to say that. And I think the more we break down the stigma and the more we all confess that now and again we do need a time out, it will become more acceptable, and it will become more of a normal thing to do. Like you would easily come in and actually, I'm really struggling today. So I think it is all about normalizing the conversation, opening the conversation, and having the confidence to realize you don't have to be, medically trained and have all the answers. And actually just being kind to people. I think there's a big push at the moment about being kind, when historically people aren't always very kind if they think people are struggling. And I think it's something, if we can just manage that, it will give people confidence to say it's okay to say I'm not okay, and nothing will happen to me detrimentally. I think there is a big stigma about you have to be strong, you have to be brave and pull your socks up kind of mentality. And actually there's a real humility in saying I'm not okay, and actually other people will not be okay. I think if we all embrace that a bit more, and if we mirror that in our teams and in the way we manage people in our culture, it will hopefully become more normal to say I'm struggling.
Absolutely, thank you, Sarah. And I couldn't echo your point more. I think around the kindness piece, just being kind to people and taking a moment to stop to really listen to the answer if once you've asked somebody how they are, to be able to spot that and continue with the conversation. So that's brilliant. Thank you so much. Brilliant. And I think we're just before we move on to the, third and final poll for today, just a reminder that the Q&A box is open. So I really encourage you to ask questions to any members of the panel today. If there's anything you particularly want to ask, please just pop it in the box, and we'd be really happy to answer those questions at the end of the session. So I am going to take us to our third and final poll of the day, which is which of these resources have you been made aware of through your work to support your own and your colleagues' mental health? So there should be a list coming up, and I think you can select more than one. So if you just want to take 20, 30 seconds or so just to fill in this poll. Brilliant, Alex. And when we're ready, if you can show the results, that would be brilliant. Okay, so we've got quite a wide range, and it's great to see that we've got some large percentages in terms of the resources, people feeling that they are aware of these resources. So 32% construction industry helpline, 86% mental health first aiders, 52% Samaritans, 11% shout crisis text line, 58% GP or NHS service, 66% aware of their employee assistance programs, and 46% self-care resources. So a wide range and some great resources, I think, available to people. And Sarah, if it's okay, I'm going to come back to you. There are some great resources listed there, but I guess how can individuals access key resources more widely? We know that a lot of, I guess, businesses within the construction industry are small and medium-sized businesses and may not have necessarily access to EAP providers. I mean, it might be more independent resources. So any kind of top tips and advice that you can give the audience today around accessing those?
Construction industry helpline, we are really an EAP for the smaller SMEs, micro businesses. You can phone us, they can phone us at any time. It's completely free. We have lots of resources. We can give financial grants. We have caseworkers that can work through all of their issues with them, tax, legal advice, mental health advice and counselling. So we are sort of the provision for the supply chain resources. We also have an app, so people can be directed to the app and they can self-serve. So prevention is always better than cure. So if they're starting to feel that their mental health needs a bit of support, or they need some support with their finances, or any of their physical issues, if they go on there, there's lots of information on the app, and it's all broken down. They can also just call through at any time. We also do offer training. So we have free training that we're giving out at the moment. We're running a campaign at the minute to give free mental health first aid training, which is just about to be extended. We're completely full till Christmas, but it's just about to be extended after Christmas. We do also have webinars once a month that cover resilience, mindfulness, meditation. So these are things that also you can implement in for your self-care and how to look after yourself and be a bit preventative. There's also work-life balance. There's obviously we wrote some as well to do with employability due to the results of COVID. So CV workshops and at the interview, because some of these things you probably haven't done for quite a while. So all of these results accessed. A lot of the larger companies I know are really great at promoting us and letting people know, but you can just get on through the app. It's a free downloadable app with everything in it.
Fantastic, thanks Sarah. And I think your internet dropped just at the beginning of that. Can you just repeat, I guess, what the app's called and the organisation that people can access that through?
Yes, sorry. So it's the Construction Industry Helpline. It's on the Play Store and the Google Play Store, and sorry, the iStore, iOS. The helpline is a free phone number. It's open 24/7, and it's I think it will be in the resources at the end, just to call. And also we've got a website that you can go to. So it's Construction Industry Helpline.
Brilliant. Thank you so much, Sarah. And Elvin, if I can come to you next. I mean, Sarah mentioned around good self-care resources, and I think there are some really great resources highlighted throughout that poll. But what do we know around, I guess, or what can you share around what good self-care looks like, and any tips for the audience around how they can look after themselves before supporting someone else?
Yeah, most certainly. Okay, but first of all, you can hear me properly, can't you?
Yeah, we can still hear you.
Yes, good. Super. Yeah, well done. Okay, so I bang on about resilience and how it isn't something you go buy from a shop. It's something that you acquire. The first thing of the 5 things I go on and on about when I do mental health talks is to connect, which means you've got to make sure that you're talking and listening and you're being there, you feel connected. So that's number 1. That's probably what the most said thing is, to be there for others, and also if you need support and assistance. Secondly is to be active. Do what you can, enjoy what you do, and move your mood. I go on about this a lot. Move your mood. When I go into a gym or at least at the moment having to work out at home or go for a jog, I am always that much more positive on my return. I've moved my mood. Don't sit and stew, move your mood. Now, the third one is taking notice. Remember the simple things that gave you joy. When I was recovering from prostate cancer, I was really lucky. It was wonderful weather. It was an August that went into the September. There's loads of sun, and I used to take a stroll just to take in the sunshine, the beautiful views. It did me the world of good. 4 is to keep learning, embrace new experiences, see opportunities, surprise yourself. Don't have to do university courses. It's things like this. Get into wanting to understand more. And last one is give your time, your word, your presence. So right now, this opportunity and the other opportunities I get to talk are all a really stable diet for me. And I can assure you is that for others, do something positive for those who need your help. I always relate this to my young grandchildren, is that the childlike mind is more in tune with those 5 things. So it doesn't mean to be childish, but being more childlike in your appreciation of life and how you get on with others. Is that helping, Vicky?
Yeah, absolutely.
Yeah. One quick last one I've started to talk about is this. We don't talk enough about spiritual health. We've got a lot of time for it, and this is all to do with coming out of prostate cancer. And one of the things I advise people is that if you had a religion or a faith and it did you some good, why not get back into that? Because unfortunately, we can't congregate, but are a great place to actually talk with others of a like mind. And so then you take that to another thing. As soon as you can, get out there and talk to others who get into what you do, be it rock music, be it any other sports. It could be chess, but that's the sort of thing about all those 5 points of resilience come out in that, and your spiritual health will actually improve no end. Hope that's helped, Vicky.
Brilliant. Thank you, Elvin. Fantastic. And Paul, just, I guess, to come to you for your thoughts around kind of resources and working in the organisation that you do. I guess any advice around how workplaces can promote good self-care to keep their workforce, supply chains, kind of mentally healthy during this period?
Sure. I think I always describe a successful mental health program as having kind of 3 pillars or 3 columns, really. And those 3 columns for me are the importance of education, the importance of promotion. I'll explain what I mean by that in a second, and the importance of providing appropriate support as well. I suppose the educational thing for me, and I guess because it's my kind of day job, underpins it actually, because you know a literate, educated workforce has a better understanding in terms of why we're trying to do what we do, and that's whether we're talking about mental health, health and safety, you know, quality, whatever. If you've got a competent workforce, you're in a good starting point in terms of trying to do the other stuff. So education, I think, is probably a given. And again, we're quite lucky because we offer anything from the sort of mental health first aid training. We have sort of bespoke programs around mindfulness and stress awareness and all sorts of other things that we're lucky enough as a big organisation to be able to have. The support side of it, really, I suppose, again, is things like employee assistance programs, things like if you're lucky enough to have it, private healthcare. I'm very mindful that many organisations don't have that. But there's all sorts of wonderful charitable organisations out there that do all sorts of great stuff. We've hooked up in the past with charities like SANS, who deal with supporting families who've been through the tragedy of losing babies. We've hooked up with eating disorder charities. We've hooked up with self-harm charities, and all of these to, again, in some way provide education, but also to provide support to our people around these specific challenges. And then finally, the promotional side of it is things like tying into campaigns, you know, national campaigns. I'm very mindful, you know, that there seems at the moment to be some kind of campaign every week, you know, around something, and you've got to pick and choose a little bit about what campaigns you choose to tie yourself into and which ones you don't. But getting on board with a good campaign, A, gives you a theme, but also I think allows you to sort of promote it both internally and externally. There's often many resources, often free resources actually available that you can utilise to get that campaign going. And one thing that we've sort of learned from these campaigns is that by getting people on board at a site level, for example, and that's not just Lemley's people, that's also supply chain people, you start to engage them, they start to look further afield, they start to look at what other resources are available out there, and it kind of almost sort of snowballs a little bit as well. The promotional thing also, I think it's very important that we get senior leader sponsorship. We need to have visible senior leadership around this as well. It tends to be that what's important to our bosses tends to be important to us as well. But one final thing, if I can quickly mention, is I'm very mindful that I can come on and I can do a bit of a sales pitch about how wonderful my organisation is, and of course you'd expect me to do that. We're a big global organisation. We probably have more resources available to us than some of the people's organisations on the call possibly have. But you know what? A movement, a culture change only needs a couple of people to start that. Any movement in any business anywhere starts with a couple of people. And going back to one of the previous polls, just a couple of people starting to have a conversation about mental health, starting to ask how their colleagues are doing, is a really, really good starting point. And that costs nothing. That requires no financial outlay at all. That requires no investment, no time. It's just people being kind to each other. So no matter how big or small your organisation is, no matter how much money you've got in the bank, so to speak, the culture can start by two people having a conversation across a coffee. That's the starting point as far as I'm concerned.
That's brilliant. Thank you so much, Paul. Couldn't agree more. I think it's especially during these times where there might be more financial pressures on businesses in terms of worrying, I think, about spend and budgets, but actually having and creating a culture for open conversation for people to talk about their mental health is free. I think that's really powerful. So thank you for sharing that. I think that leads us actually into some really great questions that have come in from the audience actually. So just on, I guess, on the theme of self-care, and I'm going to open this up to everybody on the panel. Somebody's written, I have always used exercise to manage my mental health, and currently I'm unable to exercise as I'm recovering from surgery. Any tips on how to control my headspace whilst unable to exercise, or I guess continue with self-care that works for that individual?
I'm happy to go with it, Vicky. Is that okay?
Yeah, absolutely.
Yeah,
thanks,
yeah. I have deep empathy with this. Prior to my operation to remove my cancerous tumour, I was in the gym no less than 3 times a week and swimming and all that and gallivanting like a good one. But I couldn't do that initially after the surgery. So it is very much, I've mentioned it, I found that just walking was brilliant, because actually initially that was quite a struggle. Secondly, do everything you can to exercise your mind. That sounds daft, but keep your mind active and looking at things. This is where the new experiences come in. And the thing I would stress is to find out, agree with your GP so you can project manage back to health. I did this with my surgeon. I kept in touch with my surgeon. So on a weekly basis, I said, this is how I'm feeling. This has happened. That's happened. Is it okay if I do this, if I do this, if I do that? And so I was determined over the first 8 weeks, I'll be able to get back to the fitness that I had before, but I was on the right steps. So get out there and walk as much as possible. And then the second thing is get your mind out there as much as possible. And third, consider project managing your recovery. Work as best you can with your GP or your specialist about, can we have a program so I can get back up and running? Because I do empathize. Not being able to exercise was nearly as bad as the operation.
Brilliant. Thanks, Elvin. Sorry, Sarah.
I think also there's some really great mindful apps with breathing exercises and like Elvin says, to get your mind released, so to speak. So some mindfulness activities, or even if you sort of go down the route of some meditation, it's really good for balancing the mind and just clearing a bit of a space.
Excellent. Thanks, Sarah. Brilliant. Hopefully that answered and gave some really good tips to the individual that asked that question. I'm just going to ask a question around just kind of around the conversation piece, and somebody has asked around supporting somebody who has opened up, either a colleague or a friend has opened up about suicidal thoughts, and how to handle that conversation, and if you've had experience of it, what would you do differently next time? So if the panel are comfortable talking about that and have experience, is there anything that you'd like to say on that?
Yeah, I think I can jump in there, Vic. Yeah, I suppose the biggest tip would be, don't be scared of the conversation. You know, it's okay to talk about suicide. It's not pleasant. It's not something, you know, that we necessarily want to or look forward to, but it is okay to talk about it. It's okay to normalise it from that perspective. In my experience, I've kind of been blown away actually how open sometimes people can be about it when they realise it's okay to talk about it. You know, so I think that my key tip was, you know, look, heaven knows, you know, and I know there's some experience when you're having that conversation, your heart is racing, your mind's racing, because you're thinking, how am I going to deal with this conversation? And that's all happening internally, but try and remain calm and normalise it. It's okay to talk about it, simple as. I'm sure Sarah, you know, as a mental health first aid instructor, will also have an opinion on this as well. But yeah, normalise. It's okay to talk about it. It's okay to talk about it, and I suppose following a conversation also about suicide, recognise that it's okay for you to talk about it as well. Self-care, you know, so helping somebody, supporting somebody, dealing with somebody who may be suicidal, having suicidal thoughts, can be very, very stressful. But be kind to yourself. You need to recognise you also need to possibly talk about it after the event as well.
Yeah, absolutely. It's just to follow on from that point. I think there's a lot more people that have suicidal thoughts than is realised, and it's not always necessarily a lead into a suicidal attempt. And I think, you know, as Paul said, be really open about it, be completely direct, don't skirt around the issue, and also seek to be understood. So make sure you really understand what they're saying, clarify what they're saying, ask them twice, because that's really important as well, just to make sure that you really understand what they're saying and they're really clear in their response. And I think Paul's covered it really. Just be really open about it, challenge them, and it is surprising how open they will be in return. They want somebody to really ask them directly, what is the question? Don't skirt around it. Don't be afraid of the answer.
And if I can just quickly jump back in there as well. So I lost Sarah there for a second. I'm not sure if. Sorry, Sarah, have you finished? Sorry, I lost you for a second. If I can just very quickly jump in. Sorry, that's okay. If I can very quickly jump in as well, it is a complete myth that talking about suicide encourages people to take their own life as well. Okay, so talking to somebody about it is not going to plant the thought. You know, without wishing to be too sort of flippant about it, you know, if you're having a conversation, someone's not going to say, well, I wasn't thinking about it, but I am now. You know, it doesn't work like that. You know, there is very, very clear clinical evidence to suggest that by talking about it does not encourage somebody to want to take their own life.
Could I just, if it's okay, but just give a really good example of what Paul has articulated brilliantly. When the young guy was killed on the site, I went into a spiral after about 6 or 7 weeks, and I have to say, I really did think I'd never be happy and be able to function properly again. And there were times where I thought, I'll sod this for a game of souls, I'm out of it. I can't do this. And I was fortunate enough to be able to find good access with my brother at the time. He was a fireman and he knew what I was going through. And there's one particular guy I was working with had been in the army and gone through a breakdown. They were great support. And so I can only applaud Paul. That's exactly right. You need that help. All I would like to add to that is that the Movember Foundation uses the acronym ALEC. So the best advice I got, and I give anybody when someone is seeking help, is that the A is ask. As I said before, ask open questions. How are they feeling? What do they see it? What does it feel like? You know, what are they hearing? Listen intently. So that's the second bit. That's the L. Listen intently, so they can see you listening. You are not in your head. And then the E bit is encourage them to do something, encourage them to take action. Words are brilliant, but you've got to take some action. Even if it is, I'm encouraging you, mate, to go and see your GP now. And I'll come with you if you need, I'll be there. And then the last bit, the C, is to check back in. How are you? Did you go and see your GP? Did you go and see the guys? Did you take the kids to the park? Be there for their support, because Paul's hit the nail on the head. They could just be talking themselves out of the worst action possible. I hope that's helped.
Thank you to all the panelists that have contributed to that. I think hopefully that has given the individual asking the question some good advice there, and yeah, helpful ways to take that conversation forward. So thank you for that. I think we've still got a couple of minutes left for a couple more questions, which is fantastic. So one of the questions I'm going to ask, and Paul, you referenced this earlier in terms of, I guess, wellbeing strategies as a whole, is around implementing processes and systems to have mental health first aiders at a company. And we've got somebody who said that they've implemented 25 mental health first aiders around 4 weeks ago, but have seen a slow uptake from staff. They know that this doesn't mean anyone is necessarily struggling with their mental health, but what can companies do to make things more comfortable for people to ask for help, i.e. consistent advertising? And is it normal for it to take a while for an MHFA strategy to start being used consistently by staff?
Yeah, absolutely. It's a slow burner, most definitely. I mean, we trained our first cohort of mental health first aiders back in 2013. And I can honestly say it probably took a good couple of years to start seeing the benefit, in the sense that it became clear and obvious that they were being utilised. You know, cultural development takes time, and that's what we're talking about here. So I guess, you know, the individual that asked that question, it's wonderful what you're doing. It's the starting point, but it will take time. It will take time. The people have to start to trust. They have to recognise it's being done for the right reasons, and you've got to start somewhere, right? You've got to start with something, and mental health first aid, I think, is an excellent place to start. You know, what we also did alongside the mental health first aid training was we also started rolling out awareness training as well. So we trained those people that wanted to be mental health first aiders, but we also provided the educational programs for other people. So we improved that literacy and understanding more widely in the business. I suppose if I can give you just an indicator how things can improve, though. When we first started delivering our mental health first aid training back in 2013, as some of you will know, I think it's 16 people we can put on one course, and we were frequently running courses with 8 people, 10 people, 11 people, you know, typically undersubscribed. There was always spaces on the course if you wanted to attend. We're at a point now where the second we advertise a mental health first aid course in our business, it sells out. In fact, we plan ours 12 months ahead, and pretty much the 6 or 7 dates that we plan for the 12 months are sold out, for want of a better way of describing it, within the first couple of weeks. I always have a waiting list for these training programs as long as my arm. And that for me is a real tangible indicator of where we were and where we are. You know, I'm not naive enough to think that back in the day, there wasn't a suspicion that if I signed up for a mental health first aid course, that was in some way, shape or form me admitting the fact I'd got a mental health problem. Whole stigma thing, you know, whereas now people want to come because they know we're doing a great thing, and they know that, you know, it's all about the learning process and the support process and that kind of thing. But it is a slow burner. It's not going to happen overnight. You started in exactly the right place by improving understanding, literacy and education around the subject. You're providing that support now for people, which is really, really important. It will take time to get to the point where, you know, your mental health first aiders are seen as, you know, a go-to person, maybe in the same way a physical health first aid would be.
Yeah,
absolutely. Sorry, Alvin.
Yeah, very, very quickly, just to add what Paul wonderfully said there, is that there's 3 things in change that the experts always talk about. The first one, symbols. So there's, if you can like almost brand what you're doing, and so people can see it, hear it and feel it. That's what helps. It is an advertising campaign. You also want the ritual. So Paul talked about there the ritual of the training. there should be other rituals as well, where you introduce into mornings or afternoons or something like that, so that the ritual comes. It's ritual and routines, they call it. Last but not least, Paul there has just said about the success stories. They need to be shouted almost loud and proud, and then people start to pick up on the movement. And because the one thing all companies must, and I know Lendlease will do this is not an initiative. This is a way we do business. Now it's culture, and that will start to see the results. But Paul's got it right. He's not going to get overnight success. It may dip a bit, but that's cool, because you just learn from that and you push on ahead again, completely and utterly unrelenting.
Absolutely. And I think one of the key things as well that you've both said is absolutely it does take time in terms of embedding culture change, and training can't be considered in isolation. I think is a really key thing. You need to make sure that senior leaders are engaged and really kind of advocating, making sure that there's an open culture, that like managers, project managers on construction sites feeling empowered to make sure that they feel confident in having the conversation. And one of the things I would say is for anybody that is implementing mental health first aiders into their workplace or doing any sort of training is we have an implementation guide for mental health first aid training, which is a fantastic document that will probably answer some of those questions in terms of how to make sure the implementation of training is correct for your culture as well. So we can share that round as part of the resources as well. But I'm really conscious of time. It is 1 o'clock, so I am going to just draw our session to a close. Firstly, I would like to say the biggest thank you to Elvin, Paul and Sarah for joining me on the panel today. It's been an absolutely delight to speak to you all and have this conversation. I hope this session has inspired you to continue driving open conversations about mental health. And if you do have anybody that needs support, please do make sure that you kind of have a look at the free resources that we're about to share around, or have a look on our website to see how we can support you. But thank you so much for joining us all today. If we didn't get around to answering your questions, we will be following up afterwards, and we'll also share the slides with you as well. So thank you so much, and wishing you a wonderful rest of day.
Thank you.
Thank you.
Thank you.
Thanks.